Good morning and welcome to Digital Care. Are we there yet? A maturing market but innovating just as quickly. I'm Zoe Buckingham, an international marketing consultant specializing in technology and professional services companies. Welcome. And I would like to thank our sponsors who allow us to cover so many different areas. As you can see, we have an incredible roster of sponsors, and we're very grateful to all of them. So today's agenda, well, I'll be handing over shortly to our speaker, Alan Hughes, who will talk for a short time on digital healthcare. After that, there will be plenty of time for questions. Welcome, Alan.
Thank you, Zoe. Great to see you.
So let me introduce Alan. Alan has more than 20 years experience in international healthcare advisory and works alongside providers and policymakers on the latest international trends. His company, LIT, brings together a group of highly experienced partners to bring clinical and governance expertise to healthcare providers and investors. So these talks form a series that Alan has been hosting for several years, and they're a great way to check in with how digital healthcare is evolving, whatever your industry. And I just want to give you some housekeeping notes so that you know what's going on. The slides are available to download in the chat and on the website. And we'll be holding, obviously, a 20-minute Q&A at the end. So do please put your questions in the chat box, and we'll do our best to get through them all. Okay, so without further ado, Alan, the floor is yours. Thank you.
No, thank you, Zoe. And it's hard to believe this is our fifth webinar, but I think it's actually a good opportunity to look back as well as look forward. So I think let's go to the agenda. The next page, please. What are we covering? Perfect. So to rewind, like global healthcare has fundamentally changed over the last few years, becoming much more consumer-led. Enormous leaps in terms of how digital care has become involved, and also other changes in clinical care. The alignment of today, consistent with previous years, is to look at the changes and developments in digital care from the investor lens perspective, from the provider lens perspective, and then from the policy payer lens. And for new joiners, and we're delighted to have you and welcome you, by that we mean from a regulatory and government perspective, which obviously depends and changes system by system, but consistent themes, consistent challenges. So they're the three lenses that we will look through. Go ahead to the next page, please, Sasha. Lovely. So I think in previous years, we did listen to the Q&A. We did try to broaden the conversation, and there's so many strands to digital care. So what we've typically covered are the deployment of virtual care, the use of automated imaging, online education, online communication with clinicians. So that's our typical perimeter of digital care. But in the last year, I've been encouraged to broaden that to include health management. So by that, we mean electronic records, medication management. So the world of EHR, electronic health records, which are really becoming more and more prevalent in every health provider environment. Plus the consumer side of healthcare, where many more people and consumers have sensors, wearables, in turn linking with predictive AI to help with interventions and care planning, again, depending on the person's condition. And in terms of bottom line, where this is all going, is that digital care, the traditional area of digital care, aligned with those two massive areas, health management and health tech, is accelerating innovation at a speed that's just so hard to track. But we are getting there, and we will have some good conclusions today. So just to give you the confidence that we're looking at a market that's much more mature than when we started this series 5 years ago, and much more to play for. Sasha, go ahead, please. So we'll start with a recap of the last 5 years from those three lenses, and then we'll move into some more, let's say, operational areas. What's keeping the hospital CEO awake at night? What's keeping the investor awake at night? But first, let's look back year by year, and I promise I'll canter through, but I think it does tell a story. So if we take the three lenses, investor, provider, and governance down the left, and go year by year, 2020, this is pre-COVID or before the pandemic really took charge, let's be honest. This sector was highly valued. I'm taking a broad brush of 10 times sales for young, fast-growing companies. And providers realized they had to do it, but COVID waves encouraged them to do this. Governments, and forgive me if that word's unfair, they were distracted. They were trying to keep countries and economies open and moving. So there wasn't a huge amount of focus from a policy perspective in 2020, or dare I say it, 2021. In 2021, there was a boom in investment in this space. Some very high valuations occurred because the pandemic was still very prevalent. Vaccines were on the horizon, but definitely not having their impact and wider policy. But the questions from providers were, well, what can we digitize? What solutions should we use? And governments, well, they were becoming less distracted, thankfully. And that means regulation in terms of what they would support. 2022, valuations normalized, as in less than 10 times sales and less than 10 times sales. And hospitals and providers of healthcare realized it was time to get digital. By the way, these are the sort of titles of our previous webinars. And accelerated adoption continued. From a governance perspective, the questions were, well, what do we regulate? Inverted commas, what can we regulate? And what is AI? How is it being used with radiology and imaging and automating care? So governance and regulators were becoming more focused and interested. And this links to the incredible amount of elections and government changes and other international elections that we see at present. So healthcare will always be a top 3 manifesto area. So this is becoming more and more relevant now as we look to the future. So that was 2022. 2023, let's say again, valuations were normal. The peak of healthcare investment of 2022 eased in 2023, and that aligns with digital care. And valuations definitely softened to below 10 times, and I'm using the word normalized because I think it's quite fair to say they were inflated during COVID. From a provider perspective, they were asking that the hospital management teams and wider providers were asking, well, who is getting digital and what should we focus on? Because many of these public providers of healthcare, their focus is determined by the reform areas that are set nationally. So it was blending with what can they do with what they should do. Many countries across the globe introduced digital care laws and wider regulation of digital care. And so that's a canter through where we've come from in the last 4 years. And we'll use those consistent three themes for 2024 and to the future. We'll have a little look at the Q&A, the questions and answers of the last few years. Sasha, if you go to the next page, please. So these are questions that you, our delegates who kindly join, asked in recent years. And I think it does tell a story if I canter through them. So from 2020, it was, what is it? What are its perimeters? And then the questions were how to engage in the area. There was a significant focus on the reimbursement side, as in if you're a health insurer, whether that be private medical insurer or the system that we see in Europe with the universal health coverage systems around how digital care was being adopted, for example, into wellness programs and broadening the coverage and cover which were offered to employees through the health insurance programs. Then in recent years, the questions have been around AI and how will regulation work around areas such as artificial intelligence. And as always, we look forward to your Q&A today, and we'll address these as best we can. So, aligned to the Q&A, care providers and regulators struggle to select and integrate the many solutions available, and that's a bridge to the operational themes that we'll talk about today. Thank you, Sasha. Next page, please. Okay, so stepping back from this page, the question is the question we're addressing here is what wins and where are the opportunities going forward. So the enablers of a successful investment in in digital care are the opportunities available and how companies grow from venture to growth, who the winners are, and then I wove in the ESG context. So the strengths behind investment were the support of COVID. So having COVID as a context in 22 supported the adoption of digital care at the time. Regulations, the complex regulations impact is happening. As a result, new devices, new software, and new integration is key. So if a healthcare provider is to be successful, and by default, if a company which provides this solution is to be successful, how the devices, how the software is integrated across a health system and even within a hospital is key. And I'm going to labour this point going forward, as it is the real key to success in this area. In terms of the companies themselves that people have invested in, many are at the inflection point from startup to corporate. So a business that might have had single-digit £1 million revenues to multi-million businesses. We're seeing many of those emerge now. And aligned with that, you have the big corporates, the large vendors, as we call them, companies like Cerner and Oracle and so on. They are now buying these startups and bolting on these solutions to their existing healthcare products. The winners, as in every area of healthcare, are the ones who have that patient focus, where there is a demonstration of outcomes led. So where both the solutions are helping the patient have a better outcome and also to help the system to reduce its overall spend. And then obviously virtual care in the context of the ESG outlook is clearly the fewer journeys, the fewer efforts that we spend traveling around it's more energy efficient to use certain areas of virtual care. That's to the digital care piece. So as a bottom line, a maturing sector, but the complex ecosystem, and I stress that because it's highly regulated and slightly different than many other sectors, implies constant innovation, both technical and medical. Go ahead, Sasha, please. So from the provider lens, if you're a large healthcare provider and you want to be successful in this space, so this will bridge now from the investor piece to the provider of care. Key considerations are the regulation that you're working under, the age of the site. By that I mean, for example, the hospital that you work in. There will always be areas where you can achieve successes: digitization, automation. The challenge in every hospital, every healthcare provider, is the interoperability, because there are so many legacy systems. So it's how do you make those interoperable? And then I put in private there, as in sometimes it's a little bit easier for private sector organizations to do that because they have a little bit more governance and let's say control over the interactions they have, whereas larger public systems will be open to many more areas within the clinical pathway and the health system. So the features here is that there's been a focus on regulation and clinical from the beginning. The hospital piece, newer hospitals will always find it easier to digitize. For example, a 100-year-old part of a hospital will find it tougher to automate and be interoperable compared to a new wing. And then in terms of lower hanging fruit, exactly as mentioned, digitization and automation are areas that continue to provide opportunities, but the fragmentation and ownership will always be a hurdle to overcome. And then, as mentioned, private hospital groups sometimes achieve success sooner because they're slightly more defined and more focused in terms of the clinical areas they support. And then the larger systems, as I mentioned, this varies from system to system because, for example, on the continent, many hospital systems are organized regionally as opposed to nationally. So I just took to Italy as an example, where there is good integration at regional levels, but national levels is much more difficult. So to close on the provider piece, lots of opportunity to adopt, lots of learnings, lots of areas to focus on. Go ahead, Sasha, please. So just three takeaways. I thought I'd add in three extra points here, if they're not too operational, from a provider perspective. So I suppose not every digital tool delivers what it promises. What do I mean? So hospital executives receive many propositions on solutions, but I think there's an element of the unknown with many areas. So an element of caution is always recommended when it comes to deploying or adopting a new system. Another learning is to involve, engage, and align closely with clinical teams. So every area of a healthcare provider that has a patient touch point and more needs to be involved in the adoption of these digital solutions. And finally, to test. So by that I mean roll out a small part of the program, test it and learn, see what works and fix it. So it's these are not big bang, big rollouts. These are programs that take time, but they have big impact. So they're the sort of three key points from a provider lens. Go ahead, please, Sasha. Okay, so the trickier part that we've covered in previous years is how governments and payers, and by payers I mean the insurance companies, both private medical insurers and the universal health systems, is what themes should they focus on? What are the areas that they might deploy? For example, many insurers are moving into the provision of care. So what areas can they cleverly use digital care to move into the provision of care? For example, consulting care, the use of diagnostics, specialized tests, and home care, which is an area I'm quite positive on in this space. So for example, private medical insurers are investing in complementary care platforms. For example, private medical insurers provide health coverage to large employers and of all in every sector. And in recent years, they've been including programs such as well-being, where employees can have a certain amount of hours as part of their existing coverage to have a well-being program. And these are very sensible, very easy to deploy. And they're areas that I'm seeing payers, as in insurance companies, moving into more and more. From the governance and government side, areas that are attracting a lot of support are imaging, where governments are actively supporting the digitization, the centralization of images, and how they can be shared across systems. So they're areas where I'm continuing to see more and more regulation supporting imaging and areas such as outpatient care. And the aim for all payers, in addition to obviously having a good outcome for the patient, is to mitigate costly bed days. So if digital care can be used to mitigate a patient going into hospital, then payers are focused on it. And then specialized test, I just put in that as an example. There's been a huge growth in home testing during COVID and since COVID. So that's an area where many areas have seen testing increase. and obviously test prevention is better than care. So that's an area that I see a lot of interest and a lot of government support in at every level. NHS England in particular is very focused on areas like this and very supportive of specialised testing in a home-based environment. And then lastly, the home care piece is where we're seeing the use of digital care for remote monitoring and consumer-led adoption. So they're not always prescribed or clinically commissioned, but these are the use of devices where local authorities and national governments are supportive of monitoring the patient in the home care environment. For example, enabling them to leave hospital sooner and ideally not be readmitted in the future. So lots of opportunities being considered by governments who obviously manage the regulators and lead regulation. Lots of areas being considered by payers, in this case, health insurers, both private medical insurers and internationally the universal health insurers, for example, in many countries on the continent. So that's the payment piece. Sasha, if you go to the next page, please. So I was asked to to give some sort of bottom lines and outlook aligned to the same three lenses. I'm Zoe, I'm conscious I'm coming up to the last 3 minutes of our presentation, so I'll try to run through these. So from an investor perspective, the fundamentals remain attractive, valuations are normalizing, and brands are emerging. So there are many winners who have survived the last few years. And what's very interesting in recent months and years is how the larger players such as Oracle and other big technology companies are slowly but surely buying and bolting on digital care solutions as part of their overall offering to healthcare providers. So from an investor perspective, things have definitely normalized and the fundamentals remain attractive. Wearing an operational hat and being part of or trying to be part of a hospital or healthcare provider team, the key themes from today are to test, design, retest. And the other interesting point is that 4 or 5 years ago, digital care was seen as the domain of the CIO, the Chief Information Officer. But now, more and more often, I see healthcare record and related type programs being led by the CEO as opposed to the CIO. And also the shape of a board changing to reflect the need for greater digital care understanding and awareness. And so that's from a provider perspective. And then lastly, from a government perspective, governments and regulators, I think we all recognize did not have the time or ability to focus on this fast growing space until maybe 18 months, 2 years ago. But now they're much more equipped, much more informed and enabled. And by that, I mean they have adopted and introduced legislation to support the use of digital care than before. So in closing, a more normalized space, much more understood, much more adopted, and for better or worse, much more regulated, Zoe. And with that, I've just finished a minute early.
That's very, very impressive, Alan. Thank you so much. And a fascinating presentation. Thank you for going into the detail of how all of this is currently working and the implications for investors and companies trying to get investment. So that's really fascinating. So yes, just moving on from that, we've started to have questions come in, and we had a question from Trevor Hilder asking about preventative medicine. So just basically saying, how do we kind of help people to have the healthy lifestyles that will prevent them needing unnecessary pharmaceutical drugs, etc. How do we nip that in the bud using digital technology?
It's so I think the area. So if we take it from a regulatory piece first, I think one or maybe the two areas that lend themselves most to preventative care are the home care sector and the diagnostic space, where we can prevent and diagnose before a patient ends up needing hospital care. So, Trevor, I think the two areas where regulators should and are focusing on to deploy digital care are would be in radiology, so X-ray imaging, the use and exchange of imaging in a non-hospital setting, the deployment of mobile units to people's homes, to non-hospital based centres to take images and then exchange the images via digital solutions. The home care piece, in fairness, I presented it in the context of someone leaving hospital as opposed to going in. But I suppose in a home care context, if we deploy these wearables and sensors correctly, we can prevent that patient going back into hospital um, while being monitored carefully in the home setting. Um, so hopefully, Trevor, that covers those points. But do ask me more if not.
Thank you, Alan. Actually, Shane Drinian has asked something kind of related to this about what these well-being programs actually look like, where with via private health insurance. So, the uptake has clearly been increasing, but what kinds of areas could they include? That I guess Shane hasn't mentioned this, but the kind of
Yeah.
monitoring that would actually help the insurer to keep people healthy.
Yeah. So what we have seen in health insurance coverage, so the programs that were offered to let's take large employers as an example. So maybe an organization with over 5,000 people, just as a starter, where in the past the programs were very much aligned to um, access to care and traditional clinical care in a healthcare provider setting. Since 2022, 2023, I've seen an acceleration of healthcare programs. These are from the insurers that include well-being programs. So by that, these are areas, for example, stress management, um, work support, helping colleagues that might have challenges in blending a number of um, let's say, environments while focusing on their work. So the aim, excuse me, the aim here is to help employees to stay at work and stay well, and to mitigate them needing a lot of time off. And so the aim is to provide well-being programs that prevent employees needing care that might be more formal. So the areas of well-being that I have seen adopted considerably, and they're quite easy to adopt by the insurers, are areas such as well-being, and also employers are very positive on these programs because they're offering more support and greater programs to their employees, so it helps with employee retention, which we all know is challenging in every sector. So that they're areas, Shane, that I've seen become very popular in recent years.
Thanks, Alan. Bob Webb has asked about something kind of connected to this business of sort of consumer devices, which is obviously to do with monitoring people's health. Just trying to understand how standardized they are. And you did make the point in your talk about interoperability. Do they tend to follow a common standard, or are there issues with pulling them all together with other systems?
So yes, you're correct that there are. I think I might split that, if I may, into the consumer-led piece and then the interoperability consideration in let's take a hospital setting. And forgive me, but the hospital is a helpful environment to apply these considerations. So the consumer-led piece, you're 100% correct. There's been such a proliferation of solutions that are very much consumer-led. It's up where people, whether it be heart monitoring, whether it be diabetes monitoring, there's such an incredible range of solutions that have come on the market in recent years, which is very good, and also implies a wellness approach and mentality in societies. Um, when I addressed that growth during the presentation, they're very much non-prescribed, non-clinically led, typically areas where I, as a consumer, go and I buy a device and I monitor something. So that's an area where I don't think we'll ever see a standard or structure, because the nature of IT and the nature of technology is that is very much consumer led. So we will see the Apple type watches and other monitors falling away soon and being replaced by the next monitor. So that's the nature of the consumer led area. The question on the interoperability, I suppose when I cover this in the presentation earlier, it's where there might be a legacy patient administration system, or a PAS, that has only a certain amount of information, that does not provide the full picture to the clinician, or to any management, any person in the team. And those systems have been in place in many cases for at least 20 years. So bringing in a healthcare record to align with a PAS, to align with a LIMS, and a LIMS is the laboratory system where pathology tests are done, for example, blood tests, FBCs. It is a challenge to align those legacy systems of 20 plus years with a new healthcare record. So it is possible. There are many areas of low-hanging fruit, but the point that I'm emphasizing is that hospital management do have to be wide open to the hurdles that are involved in aligning those legacy systems with new solutions, as much and as attractive as the new solutions might be. But rest assured, there are solutions out there on interoperability. It can be done. It's a case of just walking through those software development life cycles to get to the live environment and move into production, as all our IT friends tell us. So hopefully, Zoe, that answers the question on interoperability. A huge area, and will continue to be.
Yeah, absolutely. Yeah, it is fascinating. Another question that's come in is, how are hospital executive teams managing to prioritize where to invest in digital care? It must be quite a challenge. There's so many options, aren't there, Alan?
Yeah. I'll take I think let's start from a public hospital system first of all. So how to prioritize? So I suppose the initial piece is the regulatory, where there's an initiative or a national led program where a certain policy on digital care is being promoted. That usually takes precedent, because it's what funding will typically be attached to that for the hospital. In terms of the type of care, or the type of solution, I'm going to give the unhelpful answer of it depends. As in, some hospitals may have a strength or a specialty in, for example, oncology. So they may focus on solutions that are in the oncology space that help with treatments of patients in that area. So I think if I was to rank the prioritization, the first would be regulatory context and funding. So if there's funding attached to a new program, that usually comes first, because it's money that a hospital management can attract and use. Then there are other programs, for example, digitization and automation, where there's an opportunity to free up hospital management staff from maybe administrative tasks into more management of care. So they're areas where I definitely am seeing more and more hospital management teams focusing effort on. So national-led programs, programs which free up capability and capacity, and then something that just really needs to be addressed, and that'll depend on the local hospital involved. Hopefully that gives a sort of a structure, Zoe.
That's really helpful. Thank you. Yes, it must be quite baffling. There's just so many different options, aren't there? Alan, another question that we've had is, can you elaborate on the success factors which help hospitals to implement? So what does success look like?
So from a care provider perspective, the key drivers of adoption will typically be aligned to improved patient outcomes, and reducing cost, as clinical as that sounds. So it's trying to free up, let's say, capacity to look after more patients. So they are the two areas that will be guiding lights on the adoption, the deployment, and then the outcome, the finalization of a healthcare digital care program. Um, so they're key areas that will be monitored throughout. To elaborate on those, easy metrics are things like fewer bed days, fewer admittances, um, and typically areas that provide greater capacity and capability at the hospital level.
Fantastic. No, that's really helpful. Thank you. You talked earlier about the COVID tailwind. Coming out of COVID and what that had done to kind of propel digital healthcare forward. But I'm interested also in the flip side of this. So what did COVID slightly kind of boggle out of shape? What was the rush towards digitization challenging in some ways? Are you now having to unpick some of the decisions that were made?
Um, so yes, there was a rush. Yes, there was possibly an overemphasis on certain adoption areas, but I think we all agree that 2020, 2021 were difficult times for many societies and many healthcare providers. So I think the return to normal definitely led to certain digital care solutions being less used. For example, remote physio, as crazy as that sounds, during COVID, people had to do things like sometimes had to do remote physio, as opposed to going into a hospital because it just wasn't possible to go in. And I appreciate that's an extreme example, but naturally now people are back in clinic, and that's a thing of the past. So that's an example of where maybe there was an extreme move towards the deployment of digital care because it had to happen, and that now that's no longer the case. However, in areas like imaging and the sharing of images and the flexibility and adoption of solutions around imaging, that's an area that has not returned to the previous, or has not returned as much as it did to the previous exchanging of imaging. So I think areas to be excited about in this from an investor, from an adoption perspective, would certainly be radiology, as in imaging and testing, and other areas of allied healthcare that support the provision of clinical care.
Thank you, Alan. Yes, that's really interesting and great for investors to understand where the hotspots are right now. I've got a question actually on regulation and around data privacy, because you were talking about electronic health records. I know that regulation is always a kind of a cornerstone of everything that's done in digital healthcare in the UK. But I was just interested in the kind of how far those processes have standardized and embedded within organizations, and how that's carried through to suppliers who are working with the NHS and private companies.
So I think there are two strands to the question. There was GDPR and then standards. I think the GDPR is something that in whichever shape of data protection we select, there will always be a need to meet those regulations and follow those. I think on the standards question, which we may have covered in a adoption piece earlier, it's and it's sort of it's the title of today's presentation. It's such a fast moving market, despite its reaching a certain level of maturity. Standards will continue to change, with that blend of consumer-led healthcare and then the healthcare management side of it. So in the hospital, for example, and out in the community. So standards are emerging around what good looks like, what are industry norms. For example, how information is exchanged, what security is needed around those, what cybersecurity protections and other challenges. By the way, we haven't gone into cybersecurity today deliberately. It's such a massive area. So they're areas that standards will continue to change as they do in every sector, Zoe, but they will continue to change a lot in this space given the nature of it.
Thank you so much. And I think that makes complete sense that it is going to evolve. But Bob Webb was asking, because the NHS is such a huge system, and as he puts, under stress, is it providing much guidance to its regional structures around digital healthcare, or is it more from the bottom up, where it's coming about as a result of need?
It's both. It's both. So there will be national-led programs that from NHS England that impact the providers on the ground, so the NHS trusts across NHS England, and there will be locally led initiatives that the local trust will have funding for. So it's a combination of both the national-led and local-led initiatives. I'm not sure if I'm addressing the question correctly, Zoe. Is that?
That's
Do you
actually
mind?
just what I was querying with Bob, whether he also wanted to talk about sort of data privacy and how that's handled, and regulation, how that's handled, whether that's more top down or
Yeah,
dealt with on a local level. Yeah.
definitely correct top down when it comes to national policies. But if I understood the question from Bob earlier, it was how do they prioritize those two? But I think that comes down to what's important locally blended with what's funded nationally. And forgive me if I've misunderstood the question there, Zoe.
No, no, I think we've kind of talked about it from both angles, so hopefully Bob's okay with that. Yeah, that's absolutely fascinating. Thank you, Alan. Well, we're getting close to wrapping up, so unless anyone's got any sort of urgent questions, I think we'll now just sort of summarize what you've seen today. It's really been an extraordinary presentation by Alan, really going into the detail of so many different areas, from the sort of challenges for investors to NHS trusts and private companies, and getting into the technology, talking about interoperability and how that affects things, wearable devices, regulation. You really have covered so many different areas, Alan. Thank you very much. So we very much appreciate your time. And I'd like to just also draw your attention to forthcoming events that we have coming up. Some great talks on the horizon. The Pan-Livery Legacy, Big Tech Taking Over Our Money, and UK Korea Financial Forum. All fascinating talks, I'm sure. And I would also like to thank our sponsors, who are always with us, always supporting us, always do such a great job to keep the FS Club so vibrant and give us the opportunity to talk about so many different areas. So thank you to our audience for such attention and interest in the subject. And most of all, thank you to Alan for your great talk, which has been fascinating. I
Thank you,
do wish
Zoe.
everyone a really great day.
Thank you. Bye now.